My name is Jessica Day, and using this tissue pad simulator, I will be demonstrating the technique for a cyst removal for the class Rural Primary Care 3. So to start with, I would make sure to obtain informed consent from my patient and explain the procedure as well as the risks and benefits. For the cyst removal, I would set out a sterile field and make sure that I was using sterile technique throughout the procedure. So the first thing I would do would be to identify the area of the cyst, and I would clean the area starting from the inside and working my way out to about a 3 center perimeter. I would let that dry. And so at this point, I would start to anesthetize the area, and for simulation purposes, I'm using 1% lidocaine. So starting around the area, I would perform a field block, avoiding the center of the cyst. And in performing a field block, I would attempt to anesthetize the entire circumference of the cyst. Okay. And for this, I would give that time for the anesthetic to work and set up in the tissue. And I would, assuming this would be the sterile end of my needle, touch the center of the area to verify that the area was properly anesthetized and the patient could no longer feel. And then for this portion, I would set out my drape. Over the area that I'm working. And then for this portion, I'll take my scalpel and make a small incision in the top of the cyst area, being careful to attempt to not puncture through the sac of the cyst. And from here, I could use my forceps to attempt to open the area. And I would move around the perimeter of the cyst to attempt to dislodge the sac of the cyst from any adhesions where it could be attached to the wall. So I could just use these instruments to break up any adhesions. and then remove the sac of the cyst. At this point, we can also drain any purulent material or any leftover fluid from the sac of the cyst out of the area. You can express that by using sterile gauze to put pressure on each side of the open incision. And again, because we have the cyst sac in its entirety, we can then perform irrigation of the area. So we could use some normal saline with an irrigant shield. We could just irrigate the area thoroughly. And then of course, make sure that we are expressing any of the rest of that fluid or material out of the area. And once we had a good idea that all of the material, the fluid, and any remaining portions of the sac are clear from the cyst cavity, we can then proceed with suturing the area. So this would all, of course, be a part of my sterile field. So grasping the opposite side here, we could start to make a series of interrupted sutures. Making 2 bites here. And coming from the opposite side here. And then making a loop. And then back again. Making sure that suture needle is far enough away where there's no danger in cutting ourselves. And then making a couple more passes through to secure the suture. Okay. And then from here we can trim. Then we can attempt the second suture. 2 bites through the tissue. Pulling. Pulling through. Again, a couple more bites here. Pulling tight. And one more to secure. So then from there, you could go in details. And of course, this procedure is sterile, so touching here at the suture material, we would be covered. And then we will go in and attempt a third and final suture. And really, we could use as many sutures as we felt we needed to fully close the area and minimize the amount of scarring. Okay. 1, 2, 3. And I think I'll go in and just do one more fourth suture at the base here, just to ensure that there's no open areas of the incision that could reopen. And that was that third and final pass here. Okay, and as you can see, this is our closed suture and the completion of our cyst removal.